You have a cough that feels like ground glass, scraping the inside of your throat, and the doctor leaning over your bed is not holding a spoonful of syrup. He is holding a fistful of live, wriggling insects, and he expects you to open your mouth and swallow them whole. This was not a punishment, and it was not a myth passed around by gullible peasants. For more than 2,000 years, on nearly every continent, putting a living creature down your throat was considered the gold standard of medical care. And the most unsettling part isn't that these people were primitive. It's that some of them were closer to the truth than the doctors who replaced them. Picture the year 1650, a candlelit room, thick with the smell of tallow smoke, and a child's chest rattling with phlegm. The cure on the table is a handful of pill bugs, their segmented little bodies still curling and uncurling in your palm. Doctors believed the insect's legs would physically scrub the mucus from the bronchial tubes as it slid down, like a tiny mechanical brush built by nature itself. It sounds absurd until you realize this wasn't a fringe practice. This was the most respected treatment money could buy. And the woodlouse, as disturbing as it sounds, was nowhere close to the strangest thing people would swallow to breathe again. Stay with this, because it gets far stranger before it starts making sense. Travel to ancient Rome, to the writings of Pliny the Elder, a man so obsessed with cataloging the natural world that his notebooks read like a phone book for the supernatural. If you came to him with a deep, rattling cough, he wouldn't suggest rest or warm broth. He'd prescribe the crushed remains of a blister beetle, stirred into lukewarm goat's milk until the mixture turned a sickly gray ray. Picture yourself forcing that spoon to your lips, swallowing something with a pulse, because the alternative is a chest that never stops rattling. Romans believed the beetle's heat, its inner life force, would burn out the cold sickness clawing at your lungs. A sterile pill would have meant nothing to them. They wanted medicine that still had a pulse. But this cure still looked mild compared to what English mothers were about to do in their own kitchens. Jump forward to 17th century England, where a remedy called snail syrup commanded prices most families could barely afford. Mothers would send their children into the garden to gather snails by the dozen, then salt them in a clay pot until the creatures dissolved into a thick gray slime. That slime got boiled down with sugar and herbs into a syrup, and families swore it was the only thing standing between their child and tuberculosis. The logic ran on something called sympathetic magic. Snails are slippery and wet, so their essence was thought to lubricate a throat gone dry and raw. Imagine the smell of burnt sugar mixing with wet garden soil in a cramped cottage kitchen. A mother stirring a pot she believes holds her child's survival inside it. Then everything changed on a battlefield, in a discovery so unsettling, it flipped centuries of medical instinct on its head. During the Napoleonic Wars, and later the American Civil War, surgeons noticed something they couldn't explain. Soldiers left lying in mud with open, gaping wounds were surviving longer than soldiers treated in clean, sterile hospital tents. The difference was the mud. Specifically, it was what was living in it. The untreated wounds were crawling with blowfly maggots, and when doctors forced themselves to look closely instead of recoiling, they found something impossible. The maggots were eating only the dead, rotting tissue and leaving the healthy pink flesh completely untouched. Nature had built a surgeon with more precision than any scalpel in that era's hospital. Precision, discipline, survival. If insects could outperform trained physicians on a battlefield, what did that say about every disgusting cure that came before? Right now, in your own body, there are cells doing something almost as ruthless, quietly destroying damaged tissue so the healthy tissue around it can survive. You have been running this exact program your entire life without ever calling it medicine. Now go further east, to ancient China, where insect medicine wasn't just folk wisdom. It was practiced with the discipline of a laboratory. For over 2,000 years, healers have used cicada slough, the brittle, paper-thin shell a cicada leaves behind after molting, to treat violent throat infections and total loss of voice. Ancient texts describe the shell as something that vents the lungs, and clears trapped heat from the blood. Think about the deafening wall of sound 1,000 cicadas make on a summer afternoon, and then imagine swallowing a piece of the insect responsible for it, believing you were ingesting the very frequency of a clear throat. It's a strange kind of poetry. It's also a dry, papery wing, catching at the back of your tongue every single time you swallowed it. So why does all of this disgust us today, when it worked for thousands of years? The shift had nothing to do with insects suddenly becoming ineffective. It happened because, during the Industrial Revolution, doctors started practicing something called heroic medicine. To justify their fees, physicians felt pressure to do something aggressive. Bloodletting, mercury, anything that looked like a dramatic intervention. A living bug felt passive. It felt like peasant magic beneath a man with a medical degree. But the fear underneath all of it never disappeared. Well into the 20th century, in parts of the Appalachian Mountains, families would tie a live Bessie bug around a child's neck to cure whooping cough, trusting that the insect would draw the sickness out of the body as it struggled against the skin. But the darkest version of this history rarely makes it into textbooks. In certain medieval medical traditions, when a doctor couldn't determine whether a patient coughing up blood would live or die, they turned to something called a diagnostic insect. A specific beetle would be placed directly on the patient's bare chest, and the doctor would watch how it reacted to the sweat and breath rising off the skin. If the beetle died within minutes, the prognosis was considered terminal. If it lived, there was hope. Imagine staring down at your own ribs, watching a single insect's twitch, decide whether your family started planning a funeral. A bug became judge, jury, and oracle, and the natural world was handed the power to pronounce a death sentence. Not every insect cure was about life and death, though. Some played a quieter, more psychological trick on the mind. Walk into a Victorian pharmacy, dark wood shelves, the heavy scent of lavender and laudanum hanging in the air. Behind the polished glass sits a jar of crushed cochineal, tiny scale insects harvested off cactus plants in the Americas. Pharmacists ground them into a vivid, blood-red paste and sold it as a treatment for asthma and whooping cough. A doctor would heap a silver spoon with the crimson mash and hand it to the patient, who would see that brilliant red, the color of a beating heart, and feel an almost immediate surge of vitality before the medicine had done anything at all. It was a placebo running entirely on color. Here's the part that should genuinely unsettle you. We tell ourselves we've moved past all of this, that we traded superstition for science. But maggot debridement therapy is still a fully FDA-approved medical treatment used in hospitals today, deployed exactly when antibiotics fail. Bee venom is still injected to fight chronic inflammation. The insects never left medicine. We just hid them behind sterile packaging, Latin names, and a white lab coat. The next time you reach for a honey lozenge to soothe a sore throat, you are holding a sanitized, palatable version of the same instinct that made a Roman swallow ground beetle shells, borrowing power from a creature whose body knows how to do something yours cannot. For most of human history, disgust was a luxury nobody could afford. If a wriggling insect meant watching your children grow up, you didn't ask questions. You opened your mouth and you swallowed. We like to believe we've evolved past that kind of desperation. We haven't. We've just learned to dress it up in cleaner language. The fear was never really about the cough. It was always about the silence that follows when breath stops coming easy, and how far a person will go in any century to make sure that silence never arrives.